I hope your 2024 has started on a great note. Hello and welcome to the 4th episode of your favorite show Body A to Z. In today's episode, we will be talking about this new COVID variant and how you can protect yourself from it. COVID has reared its head again in 2024. The first case of new COVID variant JN.1, which is a sub-variant of Omicron, was reported in India in Kerala in early December. The World Health Organization named it as a variant of interest after 7,084 cases were reported globally in more than 41 countries. And if that wasn't enough, there's another sub-variant of JN.1, which has been discovered in India and has more than 170 people affected by it, with a total number of 197 cases of JN.1 reported in 11 states, which takes the total tally up to 4,565 active cases in India. These variants, both JN.1 and the subvariant of JN.1, are highly transmissible because it is able to evade our immunity system and is spreading and infecting people faster than the earlier versions. The symptoms of this variant are very similar to that of before. The infected person will have cough, runny nose, cold, body ache, headache, along with few peculiar symptoms such as anxiety, trouble sleeping, gastrointestinal issues, but nothing major or dire has been reported in any of the patients yet. WHO, who has been keeping a close check on all these rising cases globally, has claimed that though the rapidity and the rate of infection spreading in humans is way higher than its earlier variants, but the fatality and mortality rate isn't, which means that the infection is definitely spreading at a faster rate, but it is not as severe as the earlier variants. Therefore, you can relax a bit, but that does not mean that you take no precautions at all. Therefore, in today's video, we are just going to be focusing on the precautions that you can take, whether you're infected or not. So let's jump directly into the video. There are 4 easy steps with which you can protect yourself. I'm sure that you already know these steps by heart, but there is no harm in revising them again. Point number 1, wear masks. The season of wearing masks is finally back. But don't wear any cotton or designer mask, not even surgical masks. Wear N95 masks as they have double air filtration process. Ideally, you should not leave your house without wearing a mask. But if you have to, make sure that your face is covered while you travel in crowded and open areas. And do wear a mask if you are sick or if people around you are sick, so that your chances of catching the disease might become lesser. Point number 2, sanitize often. It is time to become best friends with your sanitizer again. Make sure that you use sanitizer after every few hours, that your hands are sanitized. Especially if you're using public transport such as metros and buses. Also, if you're using private vehicles, make sure that your hands are clean all the time. Do not touch your face, eyes, nose, mouth with dirty hands or eat with dirty hands. Also, try not to shake hands. Let's go back to Namaste. Point number 3, avoid crowded places. Now that you're done with the season of parties, it is time to say bye-bye to crowded places. Avoid going to unsanitized, busy and crowded places. And if you absolutely have to, make sure that you have sanitizer in your purse and mask on your face. Point number 4, self-isolation. The best way to protect yourself and your loved ones is by self-isolating. If you notice any COVID symptoms, isolate yourself in a room and see a doctor. Do not self-diagnose and medicate yourself, even if it's just a seasonal flu or cough. Make sure that you get it checked from your doctor and take medications and vaccinations as per their advice. If you or your loved ones have comorbidities such as heart issues, respiratory illnesses, diabetes, obesity, cholesterol, make sure that these people or you avoid crowded places at all costs. Because of underlying diseases, these people are more prone to catching this disease. That's it for this video. I hope that you keep yourself warm and stay safe at your home. I'll see you next week.